Thank you so much. Um, Thank you so much, Dr. Elaine, for this great presentation. It will be easier to me to do my presentation because your topic it was amazing. I love your presentation. Thank you, everyone, for being here. I'm so happy. I'm so blessed to have this opportunity. And I want to talk about some strategies to improve healthcare through safe use of medicines. And I want to be a little bit practice and show you a real case. I want to start with this phrase, this quote: success is not final, failure is not fatal, it is the courage to continue that counts. I think this is the story of patient safety, pharmacovigilance, because we need to go and go beyond and to achieve more more risks and do our best effort. This is the disclaimer. And I want to start with that question, why? Why we have to talk about patient safety, and especially patient safety related with use of medicines. Why? Because medicines are the most common intervention in healthcare. It is now the risks related to the use of medicines are an important cause of harm, and a big amount of hospitalizations could be related directly or indirectly to drugs. ISMP says a lot has happened in the past 20 years to improve medication safety around the world, from adoption of various medication safety technologies and elimination of handwritten prescriptions to improvements in pharmaceutical product labeling, packaging, and nomenclature. Patients are safer today than ever before. This is great because we are better now, but we have a lot of work to do. So, the WHO says that a large number of patient safety incidents occur because of errors in the prescribing, ordering, storage, dispensing, preparation, and administration of medicines, and or failure to monitor. That slide want to show that the WHO is doing a public consultation for review a draft. Here now we have the third draft for the Global Patient Safety Action Plan for 2021 to 2030. I think this will be a great guideline for all the world. The WHO says that it is important to think about medication without harm and continue doing this challenge, and to talk about safety of medical devices, medicines, blood, and vaccines, and other topics. So in that order of ideas, I want to try to show you some strategies that I have seen are important to improve in my hospital and other pharmacies, probably in the for, laboratories could be useful. I want to show you a real case related with vancomycin. This is a real patient, and I want to try to take some topics related with that case. This is a male. He had an hospitalization to treat septic arthritis with vancomycin. After 7 days, was transferred to home care hospitalization, and 2 days later came back to hospital because of red man syndrome. Vancomycin was discontinued, and the physician started linezolid. So what happened, and what should we do? I think those two questions are so important. So we're going to try to answer the questions. Okay, we have an adverse event, and we know is kind of common and could be serious. That what is the next step? Probably we could do a case analysis, take into account some pharmacovigilance tools to analyze that questions, and finally we can do an ICSR, and we will send the ICSR to the regulatory agency, and probably we will say this case is closed, And I think it's a great effort, a great way to analyze some pharmacovigilance cases related with patient safety and the use of medicines. But I have a question. What happens if we go beyond the ICSR? Okay, we could take into account some important aspects related with the personal, with the nurse, with the patient, with the processes, the protocols, and we can try to answer some questions about the time. Did the nurse have enough time to do this task? About the training, did the nurse have the correct training for to doing this task? Was the nurse tired? Probably she had a lot of patients to do to go to their home and do the same task. Was there a probability of confusion between one and another protocol? Were the protocols clear? Was it possible to access to the information? Were the communication channels clear? About the resources, were there the necessary resources to do the tasks? Was there a leader of the process? I think it's so important to have a leader in all the process because it's the head of the process, and we have to know who is the person in charge. About the patient safety culture, was there a real culture of patient safety? About the connections between all the systems, because we can have a point here, but we need to connect the system. And about the patient, is so important to inform all the things related with the treatment to the patient because he could be a point of control. If the patient know about her treatment, he could be an active stakeholder during the treatment. And about the monitoring, we have to ask, was the process monitored? Okay, taking into account these questions, I want to show that it's important to do the ICSR because it's a source of a lot of information. And we could do PV studies. But what happened if we move from PV studies, ICSRs, to patient safety strategies? And now we have a great science that is ergonomics and human factors that provide us more strategies to improve the patient safety. We must expand our vision and stop looking each aspect in particular and move on to system vision, where everything is connected and we take into account all the variables that make solid and safer processes for all those involved. I want to say about ergonomics and human factors that ergonomics is a scientific discipline that is a critical factor in the development of safer health systems and can make the difference in improving patient safety. Furthermore, it can ensure that healthcare workers feel safer physically and psychologically. I think it's so important to take into account not just the patient, but the healthcare professionals. Those are words of Carlos Aceves, who is the president of RELAESA, Latin American Network of Ergonomics and Human Factors in Health Systems, who is a great friend and who is teaching us about ergonomics. I think to think about those aspects could be a great opportunity to improve our healthcare systems. So what about the strategies? If we want to do a safe use of medicines, we need to do protocols for people, not people for protocols. We need to improve leadership. We need a leader of the process because this will be the person in charge that could improve the commitment with all the team. We need to do a lot of efforts in communication, because a lot of mistakes, medication errors are because of a lack of communication. I think communication, leadership are the most important points. And of course, we have to do process analysis to improve our processes. So, summarizing, if we need to improve our processes, we need to take into account no one to blame in the process. There are not guilties. There are persons that need to be trained. They need clear instructions, and that's the reason because we need to improve the processes, not to search for guilties. And the result is to improve the whole process. The overall vision of the system will allow us to improve safety in the use of medicines at all levels, industry, hospital, and home. Having more informed and committed stakeholders will allow us to achieve these goals. I have that question for all of you. What can we do better for our patients, our healthcare professionals, and everyone involved in this process? This is a question for all of you. I know there is not a lot of time because we could do a course, a complete course about these topics, and I would love it. So please think about it, and thank you so much.